What happens if multiple people have power of attorney and they disagree?
Well, again, I think the whole thing about power of attorney is you have to act in the person's best interest. And if you start not to do that, then questions are raised as to your suitability to it. So you all have to be able to, and that's the whole idea of it, is that you're all able to work together and act in the person's best interest.
Of course you should, but to take a brutal example, one of the decisions you might have to take is whether the patient in a hospital, this is not an osteopathy or chiropractic practice, I imagine, but the decision on whether that patient should be resuscitated. And of course one person might say, well, it's just not in his interest to do this, and he's broken ribs and all the rest of that, and he's already got dementia. And the other one might say, no, I must live as long as he can. What's the policy when two people disagree and they're both trying to act in what they think is the patient's interest?
I think just I actually had a personal experience of that actually with my dear mom really, and I think it's always a dilemma that families have is that when emotions are involved, you all have to. It's very difficult to make those decisions, really, and one of the most difficult things to do. But I think one of the things that we've got to look at is always going back to best interest. And one of the most important things that we always advocate is advanced care planning. So if someone has got an advanced care planning in place and they've made it quite explicit that they would not want to be resuscitated, then obviously that would need to would need to be highlighted and lead that discussion, for example. And if in the absence of that, it's not a decision that only families take. We've got to consider it's a best interest decision. Professionals are involved in that. And if it is deemed that the decision to resuscitate that person will be futile, is the word that we use, then that's the road that we would need to go to, really. Because if you're going to resuscitate someone and it's going to be futile, then that's not a best interest decision at all.
No, well,
and it needs to be taken into consideration.
I had an interesting discussion with the consultant in my father's ward at one point when he said he had to ask the question, should they attempt resuscitation if my father were to flatline? And we both agreed that all we're going to do is break all his ribs, and he's not going to be in a nice state when he recovers, and he's already 93, and so we said, well, if it gets to that stage, we're not going to do it. But I mean, I'm a bit, maybe I'm just a brutally insensitive soul. I didn't find that too difficult a decision to make, not least because I didn't think it was an imminent decision, but other people might find that hard.
It's always... and again, best interest is always that's always the focus is and the person's outcome is and again I mentioned the word futile, which means really that all you're doing is either prolonging that person's suffering, and that would not be in the person's best interest, really.
No.